Hello and good evening, everyone. Welcome on World Obesity Day in the program that is HeForShe. We all know that obesity is rising like a big trouble worldwide, and India is not excluded from that. We have to do many steps to prevent our population to have obesity and obesity related many complications. To this year's theme is collaborative care. So why not we collaborate with each other to fight against obesity, which is a mother of many diseases, including diabetes, hypertension, sleep apnea, osteoarthritis, and also cancer. Also, women care requires a special attention. Sometimes we tell that the man required this dose and female required this dose. It is not like that. Women are not smaller size men. They have a special hormones for themselves. They require special attention there for physical, social, mental, emotional, professional, as well as for sexual health. So if we all are aware of this situation and we all work in collaboration to improve quality of health of women care, then and then we can achieve this. And also obesity in women is also very different topic that we need to address today. So to start with that, the females require a special attention for their health care. We have amazing moderator for the from the city of Ahmedabad and one of my good friend Dr. Rutul Goklani. I would request him to start this very interesting and very informative session on this World Obesity Day about a female healthcare which requires a special attention as compared to male healthcare. Over to Dr. Rutul.
Thank you very much, Vipul Bhai, Dr. Vipul Chavda, and Dr. Dhruvi Hasnani for inviting me. This is the first time I'm here in He for She. This is the wonderful campaign, and I'm so glad to be part of it. And when I was going through something on Google for He for She, whether this is I have heard somewhere this is what I was feeling, and I came across that the UN, United Nations, started this campaign long back. So they advocate equality and urging men to actively support women's right and right not only for so-called rights but important in healthcare. So gender plays a crucial role, and there is no doubt about that. Especially as women, we know that they in terms of obesity or diabetes, when we talk, they have higher fat distribution that differs a lot. Also pregnancy and menopause that we men don't have to go through. Also body image pressure, there is always more as the fat distribution is differently there in women. So this is why the body image pressure is also there. And in Indian women, if you see, they are comparatively a little less active in comparison to men. This is why the fat distribution as well as fat deposition is a little more. Caregiving burden is so high in our Indian women. So this is why they don't take care of themselves so nicely, how they take care of their men as well as their children and family. Also, economic disparities is the biggest reason where healthcare or the healthcare in women is not so good. Also, gender bias in healthcare is there due to underdiagnosis and undertreatment. Also, weight stigma in healthcare is largely prevailing. So, policy and advocacy for gender sensitive healthcare is very much important. And without wasting much time, I would directly go to our panelist. So, first, our panelist is Dr. Parul Bhatt. I'd request Parul Bhatt, ma'am, who is
Hello.
uh, head of the Department of Medicine from Sola Civil Hospital, Ahmedabad. Welcome, ma'am. So, first question is to you, ma'am. How do societal and cultural expectation influence women's relationship with obesity and weight management? What do you feel? How societal and cultural expectation and pressure are there on women? As a woman, you can give this answer better than us.
Exactly, because obesity epidemic is there, and it is WHO is already announced that 2035 more than 75% people will is going to suffer from obesity, and women are more likely to have a affected in this because of the hormonal changes, premenopausal, menopausal changes, and PCOS is very common with this. So all these factors, the female is already having more chances of abdominal fat, or we can say the increased BMI, and that is why it is negatively affect their societal interactions. And because as we know, the woman is always been in a sense of that feeling looking beautiful or more competent or something like that. So overweight that affects their negatively in their impression or their willpower, their stigma will be affected. So overall it affects the overall health of the woman. So especially we can say that because of obesity, there is social stigma, decreases the willpower, and thereby decreases their performance also,
Confidence level, yes.
and the confidence level. And that way there is a chances of development of stress, anxiety, and to overcome all this stigma, there is again a cycle will continuously go on, and again there is a mental health issue will start. So this is a very important aspect for women to take care about it, because it mental health is more important than the physical health, and it is both are interconnected. So overweight is directly affecting the mental health as well. And after all, it will perform societal stigma will decrease their performance also in all corners of the society. And of course, the obesity gives rise to many diseases in women. That is mainly joint pain, joints are affected. So there is the hypertension, diabetes, all prevalence will also increase. So overall, physical and mental both the healths are affected when there is a obesity in women. So that is a main focus that should be taken care. And especially in women in India, there is a short stature, height waist ratio is also been very much predicted to develop the obesity. So again, more activity, nutritional deficiency also give rise to obesity in women, especially because of this again caregiver role, but they're not taking care of herself. So in that case also there is a nutritional deficiency related, we can say, is a hidden obesity is there. So these all factor affect, especially I am more focused in the woman health in form of mental health, that is psycho, so because it affects the whole family as well. One woman will carries the responsibility of whole family, and whole family, one family will develop the society. So this is ultimately the main impact on the society of the health issue. So it is very important to address the obesity in women.
Very rightly said, ma'am. And in this modern era, earlier, before maybe 2 decades back, if we see, this kind of stigma or pressure might be less. But nowadays, when in modern era, everyone is seeing model-like features in every woman they want. So the pressure is increasing day by day. And thank you very much, ma'am, for wonderful answers. So we have a second question for Dr. Dharmendra Panchal, though he doesn't need any kind of introduction. He is superstar of the day, as he came a little late. Thanks to him that he at least could join now. So he's our closest friend, and he is a consultant diabetologist from Diab. So first question is to him is, given the metabolic differences between men and women, how should obesity treatment strategies be tailored specific for women? So first question to you, Dr. Dharmendra Panchal.
Uh, Thank you, Rutul. While I joined, I just look into the program. I was looking and I just realized, okay, dot 8:35, I was able to join. So
Wow.
again,
So just
let's make
just
it.
5 minutes late.
I could be at least, on time, dot time. Coming to your question, that gender differences and its metabolic effect and how it should be tailored. Now, you know if we talk about these gender differences, male and female, it's not only physical difference. You can talk on other three aspects also, which I think Dr. Parul ma'am has touched. a bit, that is a emotional level, psychological level, and I would also add upon spiritual level. And if you just compare the, even a couple who lives together, their life goes on one hand and other hand differently, in spite of living under one roof. So of course, when we talk about tailoring the obesity management for a female, it will differ 100%. The advice which has to be given to the male, looking into account not only this genetics, but epigenetics, the environment which surrounds her, either it's the home or the office, and of course their own hormones which make them, and the age at which he or she gets affected. So either it's a teenage, where also that hormonal imbalance are bound to occur, then throughout the reproductive age, and then postmenopausal era even. So apart from this routine obesity management, which usually includes in the terms of diet and exercise, it has to be a very much tailored, specific to a person's lifestyle, specific to a female's perspective. And yes, the most important, that emotional health and psychological health, they are important. So I would agree that yes, for when we are coming to the obesity management in a female, it has to be tailored. I would say rather, not for the female, for each individual female, it should be an individualized obesity care approach, looking into account their physical age as well as surrounding. So that will matter a lot. I think that was the
Right,
question, right?
right, right,
Okay.
right, right.
Yeah.
So, thank you, Dr. Dharmendra Panchal, for beautifully explaining that how treatment differs in women. So, my next question is to Dr. Urvi Parekh. Are there gender-specific biomarkers or screening methods that could improve early detection and prevention of obesity in women, ma'am? So,
Yes,
which
there are
biomarkers you expect?
which are
Yeah.
specific for a female, and looking to female obesity, we have to divide them into different age group. In childhood or adolescent age group, there will be prepubertal and pubertal changes. So in that woman, the fat deposition starts from as early as 7 years of age, and it lasts up to 16 or 18 years of age. So at that time, PCOS also matters. And after that, if we come to the menstrual phase, or we can say the conceptional phase or reproductive age, in that preconceptionally and post-conceptionally, there will be progesterone, which increase the obesity in female. And so it is different from male. And the female with same BMI as male, they have more fat. So we have to consider them as different. As well as for pregnancy, for menopause, females are considered to be different. Now, in periconceptional and post-conceptional, we have considered the progesterone may be the cause for obesity. Then again comes PCOS. In that, insulin, plasma insulin, and certain metabolic factors, and one particular sex hormone binding globulin, which is also important in PCOS, which leads to free estrogen. Now, estrogen in women at reproductive age group, it leads to fat deposition in lower area of the body, and the abdominal belly fat will not be there. But as and when female reach to the menopausal age group, estrogen will be reduced, and there will be more androgens, and the abdominal fat starts increasing. So there will be more cardiovascular risk for that postmenopausal women. In particularly the menopausal women, there are certain specific biomarkers which we can consider as a gender specific biomarkers. So the vispatin, the adrenaline, and adropin and adiponectin, these are the three newer biomarkers which is accordingly more or less in a postmenopausal woman. So this is considered a specific biomarkers. Otherwise, in both gender, there will be inflammatory biomarkers like IL-6, TNF alpha, and plasma insulin, causing insulin resistance and obesity are also important.
Right. So, thank you very much, ma'am, for explaining it in age-wise distribution of biomarkers. So, our next question is to Dr. Vidisha Patel, who is a consultant diabetologist from the area of Gotha in Ahmedabad, from Vardhan Diabetes Center. So, my question is to her is for nutrition. And you know that nutritional counseling is so important in obesity management and prevention even. So how do dietary interventions need to be gender specific? So I don't understand, this question is really difficult, that how nutrition counseling could be different, and I would like to hear it from you.
Right. Thank you so much. And first, I would like to thank Dr. Vipul and Dr. Dhruvi for multiple times conducting he for she, and which is very much needed as me being a professional and a mother and a wife and everything. So it becomes very important to have something where is he for she and doctors like Dr. Rutul and Dharmendra, motivating us for all these things. So thank you to all the doctors, male doctors present here. And thank you, Dr. Rutul, for the question. So coming to the counseling, nutritional counseling is very important. And as in our routine practice, what we say to the patient is four things, four pillars of diabetes, or this thing is important. There is diet, exercise, sugar monitoring, and medicine. And roughly, we would say these things you have to take, these things you have to avoid. But for the patient, it becomes very difficult on the daily basis what they should consume and what they should not consume. So for that, a detailed counseling should be there. For that, if we don't have time, we should allot a nutritionist in our clinic, which they can have a diet recall, considering women's physical, women's age, their ethnicity, their financial status also. Because sometimes if we advise patients very not pocket friendly foods, that also would be very difficult for them to take on a regular basis, so they won't take it. And what things are available near their area and all, that is very important. That's why counseling of the nutritional aspect of the patient, that is dietary recall and all, is very important. And for that, nutritionist definitely should be there. Again, if we call the patients in terms of diabetes, every 3 months we would advise. But for obesity and prevention of weight gain, for that, I would advise a specific one-on-one person allotted, with whom that female can talk and discuss her own difficulties which she is facing in terms of mental health, or maybe weight gain issues which she is having. She might not directly tell to the doctors, considering male doctors sometimes. So female doctors, sometimes it is very easy for them to coordinate also. Again, with the question which you asked is gender specific. Some of the diets, yes, definitely are not gender specific. That would be a universal diet, which is like a healthy diet, which we would promote. Not something very low carb diet we are not promoting. We are promoting healthy diet, which they can take for a longer period of time. But again, yes, PCOS women, we would specifically give some specific modifications of the diet. Then PMS, premenstrual syndromes, are very much there in the females. So mental health is also at a toss during that time. So yes, and premenopausal. So diet in that way, like we can advise patients to take more of the protein diet. That is very important. 40 plus patients, yes, calciums and all are also very important to take. So supplementations along with that are also important as a doctor or as a nutritionist counseling if we are advising. So that is very important for any of the women coming to our clinic.
Okay, right. Very true. So, again, the age-wise distribution for diet is also very important. And yes, nutritional counseling in women should be specific, and it can't be generalized in most of the patient, especially when it is PCOS, gestational diabetes, when it is about PMS, and also after post-menopausal women. So every time we have to take care of their nutrition differently. And my next question is to Dr. Dharmendra Panchal, that in your experience, what are the biggest clinical challenges that you face in obese women with comorbidities like PCOS or gestational diabetes?
See, would first start with a generalized, obese woman in a family. Again, it's like we have seen since long ancient times, a female adapts to the family, whether it's a daughter or it's a daughter-in-law or mother. Always we have seen that a female keeps her health at the last. She tries to adapt to the family, and that's one of the biggest problem when it is about to address a woman's health, obesity, and when it is associated with PCOS, and of course gestational diabetes. So nowadays in this era, in many cities, the situation is quite well, but still that mentality that is there. What happens is when specific pattern of advice are given to a female with obesity, I love to give advice as a whole family. So it's not only necessary for her; it's necessary for the whole family. And if the message is given in that way, then I think this challenge we can come over. One more point: when it is a teenager or adult female in a with obesity in a family, she has to face many issues, or we can say some sort of bullying from the family members as well as school friends as well as the colleagues even, and it has to be addressed very carefully. And this requires again details explanation and details counseling. With the group counseling, it is required. Just would love to share my personal incidents. That school exam were going on, and I got a call from my wife that I advise her the daughter to complete this work, and to my surprise, when I came back from work, she has not done, and that stress of exam was on her rather than my daughter. And the same while meanwhile I was going through a novel, and I post on the Facebook also, and I got the quote from my friends and all you, even Rutul, Dhruvi, and Deepak also, that everyone around us, they are doing their best, even if it is their best is mashed. So that we should, or we will have to make that thing to fill to the whole family, that female member, or with obese or without obesity, they are the center of the family, and whatever the advice has to be delivered, it should be with the whole family. So family counseling is much more important, and this is the biggest hazard, I was sorry, biggest challenge which prevents us from treating a female member with obesity or any metabolic disorder. Whatever advice we give in the follow-up, it comes, doc, I have to wake up at this, I have to make a tiffin for my son and husband and this. So itne mein mujhe time hi nahi milta hai ki I can do something for myself. If that is delivered for the family, whole family has to do this, then I think this challenge, which is a major hurdle in the treatment of obesity, we can come over. So this is the one of the biggest thing, I would say, as far as this counseling nutrition session is there. And then coming to the treatment also, because treatment in the terms of pharmacological management, again there is a myth in the whole family or in the whole community regarding if something pharmacological agent is given for the obesity, whether it will affect her reproductive life or not, or what will happen for the future. So that again needs counseling first, then starting the treatment, explaining each and everything about pharmacological part of the management, including injectable therapy. Gestational diabetes, I think we are due to our community, quite fortunate that every advice given will be followed by the whole family. And whole family, the support is enormous when we are dealing with gestational diabetes. But the same support has to be maintained in the postpartum postnatal period. Even that is somehow lagging. Even female herself becomes non-responding to the our advice which she was following meticulously. So these are the few challenges which are there when we are treating our female patient with obesity with comorbidities like PCOS or gestational diabetes.
So thank you, Dr. Dharmendra, for wonderfully giving answer of this question, especially specifically for comorbidities like PCOS and gestational diabetes, where the clear message is for families and not only for women. And this is from you. So next question is to Dr. Parul Bhatt. That can you elaborate on role of mental health in obesity management for women and how it differs from men? So how mental health of men and women are different from each other, ma'am?
Uh, Very good question. Actually, it is the main culprit for the development of obesity, and the main terminology is stress management. Here we have to go mainly ask for the stress management, and in that case, there is always, as heard from the previous all, that stress is always more, because now in a corporate life also the women are entering, they are doing equally good, and they have to perform excellent in the corporate place as well as at home also. All the responsibilities of families are already there on our shoulder, so always there is a stress. So there is always a difference, and men is already have given some more strength and courage naturally, because there is a constant level of testosterone is always helping naturally to give them a more courage at all the time. They can have more capability to handle most of the things, but the
Women
female,
are
with the
more
hormonal
courageous, ma'am.
cycles are changing. So when there is a estrogen level goes down, there is a hormonal imbalance, and there is a related mental ill health or something like psychological changes at that time. So this is a natural phenomena, but there is always a way. There is, when there is any problem or any situation, there is always a solution behind it. So in that case, what exactly the stress management is required for female is we can advise them for a great effort. There is one formula we should all apply to our patient and for ourselves also. That is a, previously there is no such word. When there is a five children in one family, the lady was carrying, and a big family staying, 25 people are staying together. But there was no stress. They all are very happy. So that means that there is, once upon a time the people can able to manage everything. Nowadays we are not able to manage all these things, and female are already in more stress because of these two part they have to play right now. So what exactly we have to teach our patient is that there is a fun formula, that is stress is equal to pressure upon resilience. So when the denominator is resilience, that is a willpower. Once you have a more willpower, this denominator will be more, then the stress part will be less, because it is more than one we can take. So this formula, every time we should ask our patient to have a great willpower. Everything will be going to great, and this willpower will be created by the calm down and by the meditation every day morning in 15 days, and in at the end of the day 15 minutes. That is the help to encourage to develop the willpower, and this is especially for women when there is a more responsibility on her shoulder. At that time we have to take I mean counsel her in such a way that there is a whenever there is a something we talk about spirituality or holistic approach, the people will think it is because of the for the older people or those who are retired, but it is not nowadays true, because the obesity, the main factor is the stress, and this is required because cortisol increase in the body when there is a stress, and there is increase the gluconeogenesis, and there is an increased conversion of the glucose into the fat, and all this mechanism we know. So this is the best part. We have to break this cycle. stress management is the main part, and especially more focus for females for the stress management, and that is been only been done by the increase their resilience, the sharing of the responsibility in the family, sharing of their all the problems with the friends and socially, and then as we know there are more and more get-togethers and all these, so that will help her to come out from all these routine activities, and this is I think best for the stress management. So spirituality should be included, and there is a terminology also one after this formula, that is team management, that is thought, emotion, attitude and the memories, that we should also address to our patient, that you should just focus on your present, or past and future worries will also increase their cortisol level, and there is always a chances of development of hypertension, obesity and the or consequences like diabetes and pc. So I focus mainly on the stress
Present.
management in female is more and more important as compared to, however it is for everyone, but this is what I feel. So thank
Wow.
you.
Thank you very much, ma'am, for wonderful and elaborated answer. So wonderful words that were actually you were like singing, and it is to our ears. It is so beautiful that resilience, willpower, and sharing responsibilities and all. So really encouraging and motivating words for all the women present here. With this, I'll hand over the session to Dr. Dhruvi as I'm getting late for another engagement. So thank you very much again for giving us the chance, and see you all again soon.
Thank you.
Thank you.
Thank you, Dr. Rutul, for being the he to our she. To continue with the same panel, I would take up the question from one of our audiences. We've got more than 285 people logged in, and I would like to ask Parul ma'am about this. What about management of a post-menopausal obese lady? If you can quickly tell our audiences some quick 4 tips on what should be done.
Postmenopausal is a very, very important period for the life of any woman, because it is the area where she is having a more fluctuation in mood changes, or something like a more responsibility at the same time, because the age is that she is having more responsibility of family as well as career, and there is a hormonal changes, so the body is bombarding with the so many stress, but the focus is once again, and a routine we can advise fluid restriction, salt restriction, more exercise, and aerobic exercise as well as stress strengthening or muscle strengthening. This is very, very important, because of the sarcopenia also start at the after the age, this thing, menopause. So if the body is fit, that the mental health is going to be again, the fitness is more, so there is again both the fitness should be increased, and the postmenopausal period is a very, very important to give rise giving her a very supportive role from the family at that time, because it is same like we can say like at puberty what are the hormonal changes, it happen at the middle age also. So there is more family support, especially for the life partner, from the children, and of course from the society. So she should involve in a good activity, some reputed NGOs or something like a seva, something like a work like in which she enjoy working. So all these will help to manage the menopause area.
Thank you, Parul ma'am. I come back from post menopause to a 14-year-old girl, Urvi ma'am. There is a question from our audience. In a 14-year-old girl with PCOS of 92 kgs, should medicines be prescribed? Should pharmacotherapy be prescribed, or lifestyle modification is the answer?
Definitely, I will go for medicine also, along with lifestyle management, not without lifestyle management. Diet and exercise is the first and foremost, followed by medicine. And if there is a insulin resistance, we will like to give definitely metformin and reduce her weight. That is most important in PCOS.
Thank you, Urvi ma'am. I come to the he of our panel again, Dr. Dharmendra. Dharmendra, bhai, you've very elaborately talked about how important the role of a family is. What have you personally felt? What could be your advice to the female across age category as a wrap up for this panel? If you could give us one take home message for all the females, be it medicos or non medicos across the age category.
If you want to invest for your health for any problem, I would say invest for a personal trainer. Go and get exercise. It is one of the best stress buster. It is the kind of the phenomena. You just wake up in the morning, go for the exercise for 15, 20, 30 minutes, your day is done. So this is the only advice I would like to give all the members, all C's of our panel, that just invest for your physical activity. Get the physical trainer and go and do regularly exercise. That is done.
Amazing. Thank you, Dharmendra bhai. I come to the she of our panel again, Vidisha. Vidisha, you've been an exemplary mother. You are an excellent clinician and you're juggling all your career and personal life together. Take home message for all our audiences.
To say from my end, just be you and balance the things. Just take it as it comes. It's as simple as that. If you want to balance all the things, it's not going to be possible. Try to be so that is the most important thing, because with that your mental status will also be at calm.
Okay, so I think the network was a bit patchy, but you were telling let us be ourselves and not let anything else, affect us. Urvi ma'am and Parul ma'am, she's very quickly one-liner for all our audiences to wrap up for the NCDs and women health.
I will like to say all women that take care of yourself before others and always take time for you.
Thank you, Urvi ma'am. Parul ma'am.
That is the same, like everything is manageable, and don't set the high goals. If you have health first, and then work with which work you are having satisfied with this work, and do it happily. That is what all the goals you will achieve if you are healthy. Otherwise, you will not enjoy what you achieved. So that is what exactly, the health first, and then the happiness always comes behind it. So this is what my suggestion for all the women in this World Obesity Day. Thank you very much for having me here, and this is really a wonderful initiative both of you are doing every yearly. Thank you very much.
Thank you, ma'am, and thank you to all our panelists again. And before we move on to the program, I hand it over to Dr. Vipul again for bridging the care gap for this HeForShe campaign.
Amazing discussion I have encountered in a long time. The women's and men's are talking about the women health. Of course, man has to be a flag bearer for advocating for women health, and that's what we are doing right now. Whether it's a World Obesity Day, whether it's a International Women's Day, whether it's a International Hypertension or Diabetes Day, but men physician of our country has to be a stalwart for advocating women's health, because women are not fighting at one end; they are fighting at multiple points. And when men are supporting them, the job of women become very easy. So let me all take you all to the drive of our second session, that is on addressing the taboo topic in women health. And before that, I would like to thanks Dr. Urvi ma'am, Dr. Parul ma'am, and my one of the uh, great friend, and sometimes I have very deep interaction with whom, Dr. Dharmendra. Thank you, Dharmendra, for being here and guiding all us. And also Dr. Rutul and Dr. Vidisa, close friend of mine. And let's start about talking about very interesting and less talked topic about women health. What are the taboos? What are the undiscussed topic about women health? So what about sexual well-being and sexual dysfunction in women? What about bone health, osteoporotic things? And what about the things that we don't know that we don't know? So there are four things that we know, sometimes that we know we don't know, and sometimes there is something is there that we don't know that we don't know. And first of all, I would like to invite Dr. Bansi Sabu, sir. Sir, please, if you can turn on your camera. Sir is busy with multiple webinars today. He is kind enough to be with us on this very busy World Obesity Day. He is a torchbearer for all humankind, I would say. He is not a bias by women's health, men's health, children's health, or even gender non-specified. We have seen all the patients being treated by sir equally and with equal love. Thank you, sir, for being here with us. And I would start this HeForShe campaign on World Obesity Day by asking you the question, because you are the most experienced person here. Sir, please guide us that what are the female health issue that are still not discussed over any platform, particular about metabolic disease.
First of all, Vipul, thank you for very kind words. Thank you, Vipul, Durvi, for this wonderful program which you are organizing. She for he or he for she. I mean, it's a wonderful program that what you are talking of. This is a very unique opportunity for us by one way that it is on on Obesity Day, which is coming just before World Women Day too. And at the same time, we are discussing the women health issues, particularly the metabolic issue on Obesity Day. Why otherwise unique opportunity? Because we are online connecting more than 800 or 900. Just now I got the information that, from 900 healthcare professional, which is really very difficult to get the people face to face. So it's really unique opportunity for us because online we are connecting and understanding the issues which are there with women health. There are a lot of metabolic health issues which we are now started discussing. Whether you are talking of a dedicated meeting which we have on women, we have dedicated meeting on metabolic issues which are there. But some of the disparity which we see in our society, particularly in rural community, it is still very high. One thing which is I always feel psychologically, any woman, they feel that postmenopausal they tend to gain weight, or during pregnancy or postpartum or after the cesarean section or after the hysterectomy they tend to get weight and they accept it. That is some issue which is I think the women are not understanding. I always try to compare that with some of the Bollywood star that they also get menopause, they also get the delivery, they also get the boy, they also get the cesarean section, but they never gain the weight. It means there is somewhere we are psychologically accepting this weight gain or obesity in women postmenopausal or postpartum, which is accepted by the society, and that is something which is creating a lot of metabolic issues to these female, whether it's a diabetes, whether it is heart disease, whether it is a osteoporosis, whether it is a osteoarthritis, and it is universally accepted by people. In India, there is a very interesting study which is done in female, particularly in urban area. It was in Delhi, and they found above the age of 40, every other second woman found to be obese. And central obesity in all these women were very, very high. It was like half of your height, more than height of your body. If you have half of your abdominal girth is more than half, you are prone to develop heart disease and diabetes. And most of the females in Delhi area, above the age of 40, their abdominal girth was more than 80 centimeters. So if someone is not very, very aggressively working in the field or doing some aggressive exercise, found to have at least central obese. And this was the data from our urban city, Delhi. So I'm sure similar type of area we will be having even in Ahmedabad or in Gujarat, other area. Maybe in some rural area it may be less. So this acceptance psychologically by these females is really something which is really increasing the risk of central obesity or obesity. As I was listening just before about the menopause, Dr. Parul Bhatt was also saying that it is the stress level which is the major reason for them to develop obesity. Maybe they find pleasure in eating, and that may be the reason why they gain weight. But because it is accepted by the society also. Everyone, if someone at the age of 50, if she wants to remain lean and thin, everyone in the society will say, why you are so lean and thin? What is the reason? Is it some issue which you have, why you are not becoming overweight or fat? That's sort of a society acceptance that people should become obese and overweight, or the female should become overweight and obese. So this psychological issue and some sort of a mental acceptance by female, this is to be discussed more, and that requires more awareness. And they should not agree that yes, they will gain the weight during postpartum or postmenopausal or post-hysterectomy. They should fight for it, and they should try to decrease their weight, or they should not try to gain the weight. I mean, something they should do more for that, and that will make them really healthy. They will have, if they will be healthy, they will be more happy also.
Yes, sir. Thank you so much for addressing and throwing light on very untouched issues about female health. So to battle these all problem, we require some strategy. Before planning proactively, we cannot manage many situations. So I would like to ask Dr. Dhruvi that females are already overburdened, and when they have any chronic condition like diabetes or hypertension, their burden increase of course. When they are juggling between their family, their work, their social expectation. Just today afternoon, we encountered that there one female doctor who is very well known in her field is not attending any meeting because her
Yeah.
sir is selling something. So she's not attending any meeting because her husband is also a doctor, but from different specialty. So they have to attend their meeting, and that's why she's sacrificing her meeting to be on academic front. So can you guide us that what can be the strategy for this harmonization? I don't believe that there is a balance possible in this world because everything is in a different motion, but we can harmonize and harmonize. So please, Dr. Dubey, throw us and throw light on this and guide us about this balancing or harmonizing the thing.
So let me start by saying a thank you that you heard me when I said this in the morning that let us discuss this at the webinar. That is overwhelming. Thank you for listening to me at that point of time. Women are conditioned in a way that they have to take care of their family and put everything on the back seat. It is a centuries old conditioning and programming. We are not here to change the person's choice, but we are here to advocate that everybody has an equal part and an equal role to play when an upbringing of a family or running of a family comes into the picture. We heard all the previous panelists, be it Banshi sir, Dharmendra bhai, Parul ma'am, Urvi ma'am, Vidisha, everybody talked about how females are putting themselves into a backseat. And the take home message of every panelist was that please put yourself in a priority. Please consider that you have to take care of yourself. On top of that, when a woman has any of the chronic condition, it becomes very overwhelming that she has to be a caregiver. She has to take care of her professional life, and along with that professional life, she also has to take care of herself. And a lot of us present on the panel would have, been through that, gone through that. Our listeners would have also gone through that. It's an additional emotional contributor to the anxiety and stress that we have. And sometimes the females don't understand that it is the exhaustion that adds on to the hormonal fluctuation. It is the stress that adds on to the variability of the chronic condition that they have. For example, women don't come forward for timely screening and diagnosis of their diabetes. So that delays the screening and diagnosis of their complication also. That delays the control of their glycemic status also. That delays and promotes and puts them into a position wherein whenever they are coming to us as healthcare professionals, they are already coming with one or the other complication. And by the time you want to intervene and do something, it's already almost on the verge of being too late. So it's it's very hard for me right now to even propagate that idea that when you are taking care of yourself, you're not being selfish. Please don't consider that. That's the one message that females have to consider. And Dr. Vipul and I were also talking the other day that why are we putting the blame onto the females that you are not prioritizing yourself? It's the conditioning. And that is why this campaign, that all the he's present here have played their own role, a very important role in pushing the she's in their life, to take care of herself, to maybe, prioritize herself, and, putting her on the forefront. Like Dr. Vipul just, I felt really nice again, Dr. Vipul, that you heard me in the morning and you've brought back this, question for the webinar today. And Banshi sir, again through this webinar, let me tell you that you have been a very important he in my life, along with the he's of my family and along with the he's who are my colleagues and who are my friends. So thank you. All the females have to understand this, that prioritizing ourselves, taking care of ourselves, screening ourselves, getting a blood test done is not a selfish approach, is something that is a required thing. And if you are okay, only then will you be able to take care of the family as a whole. Over to you, Vipul sir.
Thank you, Durvi. Superb.
So Bansi sir is, as I already mentioned, is universal. He is he for she. He is also he for he. He is also he for it. He is for everyone. Thank you. We love you, Bansi sir. And let's start about sexual health. Yes, sir. You want to add something?
Thank you. No, no, thank you, Vipul.
Okay, sir.
Let us continue with Nimi.
Okay. So also let me talk about something that is more talked, but talk behind curtain. That we all have a discussion about sexual thing, but not on the forefront. When we talk about a metabolic disease, we all talk about obesity, we talk about hypertension. However, we say that body shaming is good or bad, but sometimes or other times we talk about that and we go to doctor or clinician or healthcare provider with their complaints. But when the things come about sexual well-being, the patients as well as doctors, as well as other healthcare providers also feel a bit hesitant. So let me ask Dr. Nimi that how come this metabolic disorder affects the health of an individual, specifically when the individual is of female gender, and how they should come with a positive approach to their clinician to talk about that. And also I would like to ask Dr. Nimi that how healthcare provider also break the ice and start conversation on a positive note with a person who is having metabolic disease of either gender. Over to you, Dr. Nimi.
Thank you, Dr. Vipul. Before coming to the answer of your question that you very deliberately asked me, I would like to put a comment on Dr. Dhruvi's footnote when she said that being selfish is, we see as it is a crime, but those who are listening to us, seeing to us, and if they know Gujarati, one of the names of Lord Krishna is Ranchod. He fled the fight to save millions later. So, since when being selfish is a crime? Since when taking care of your own health to help support your family, to help support your patients, and making them achieve their best of their health is wrong? And as female physician, as female clinician, since when us advocating to our females patient that they should take care of their health is wrong and should be a taboo. Now, coming to the question of Dr. Vipul, that what sexual dysfunction, metabolic disease can bring, and how can we open the conversation? When we talk about sexual health, we use a particular tone. It's called hushed tone. We reduce our voice, we close the door, and then we talk to the patient. As if it's a crime that they are committing, asking the question. It's a crime we are committing, answering the question. In the reality, sexual health or
physical well-being is very much a part of a generalized health. When we talk about health as a definition, it's not only physical well-being, it is emotional well-being, mental well-being, financial well-being. So sexual health falls under both the categories of physical health as well as emotional health. There can be multiple causes of sexual dysfunction in patients with metabolic disorders such as type 2 diabetes, obesity, hypothyroidism. All of these can cause to painful intercourse. It can cause to reduced sexual desires, loss of libido. It can call vaginismus. It can call loss of desires. It can cause dryness in the vagina, constant itching, burning sensation. And to make sure that we talk about these topics to our patients, we should be the one opening the conversation, not hushing it. If you want to provide a overall well-being to our patient, we have to keep the conversation open and non-judgmental, non-biased. If we are biased sitting on that chair, the patients are anyway scared. So we have to understand that we have to open that curtain, let them come in, let them open up, and this can be done as simple as in a box of history taking. Just when we ask about vitals, when we check vitals, when we check about their eating pattern, we can just ask, how often do you consummate your relationship? How often do you feel the desire, or how often do you fail to consummate it? These are some simple questions, and once you start talking about it, creating a safe space for our patients, be it a female or a male, then they start opening up and then providing them with treatment, not just words. Everything will be fine. This is just hormone. You lose some weight, it's going to be well. It's not that easy. With good and encouraging words, the patient also need proactive treatment. So, as a clinician, we can provide three things. We can provide a safe space, we can provide an open dialogue, and we can provide a proactive treatment or management that is safe for the patient.
Amazing. That was really well, conscience answer to the sexual dysfunction question. Vipul sir is here.
Yeah, Dr. Dhruvi, Dr. Nimi, you very wonderfully explain and teach all of us that it is not an thing that we should not talk. We should talk upfront. It is a very important part of a healthy lifestyle. And I always tell patient that the health is not merely absent of disease that we learn from WHO. It is a physical, social, emotional, spiritual, even sexual and professional well-being. So we have to maintain health in all the direction. So to the last panelist of my panel, I would like to ask Dr. Smruti Trivedi if she is here. Yeah, she is here. So bone health is also very less talk. આપણા હાડકા મજબૂત હોવા જોઈએ ને હાડકા ખોખરા ના હોવા જોઈએ આપણે ગુજરાતીમાં કહેતા હોય છે પણ to have good bone health specifically around perimenopausal age is very difficult and also a very less discussed and very less interacted topic. So can you guide us that in a spectrum of metabolic health, how the bone healths are very important, and when we are talking about female health, how should they take care of their bone health, and also how we should evaluate periodically about the healthiness of our bone. Over to Dr. Smruti.
Hello. First of all, I want to thank Dr. Dewey and Dr. Vipul for inviting me and giving me this opportunity. Now, very important topic. Yes, it's very ignored topic, like you said, Dr. Vipul. Everyone knows about the bones, but it's not talked about. Secondly, like Dr. Bansi Sabu sir had said earlier, how we have sort of normalized being overweight. That's how it is. We have normalized, like, oh, after a certain age, yeah, bones hurt. So what? That's what happens. So I think that's the mindset we need to change. That no, bones don't need to hurt. What they have to understand, or we need to make our patients understand, is during perimenopausal phase and menopause, estrogen will start increasing. And because of that, osteopenia starts happening. Your risk of osteoporosis goes quite high. Therefore, we need to start taking care of bone health earlier, just like strengthening exercises, weight bearing exercises, walking, and especially that will in having diabetes or any other risk factors will increase the chances of getting osteoporosis. So, in order to prevent that, first, of course, we need to get everything else under control. Maybe diabetes, hypertension, whatever other diseases that they are facing. Secondly, along with that, we can advise them to start doing weight bearing exercises or even just walking in general for 30 minutes daily from early on. I would suggest from the age of 30, that's when they should start taking care of their bone health. Second, vitamin D levels. Most of the people, not just women, even men have low vitamin D levels in our country. So that's a big thing. We need to check their calcium levels, their vitamin D levels, and simple. This is what I tell my patients: drink milk, because a lot of people don't drink milk. They like chai. We love chai. So I said 1 glass of milk, that will help you decreasing taking the number of tablets. So I always advise them this, that please, at least, you need to have some calcium. So start taking care of your bone health by get your vitamin D levels checked, take some calcium, instead of taking calcium supplements, take the natural sources that we can get. But if you can, then of course medications do help, supplements do help. And I always advise them, start early. Earlier you start, better it is. So I would say at least by the age of 30, because that's when we start prioritizing our health a bit more. We're aging. Weight bearing exercises, like I said, they really do help. If you don't want to do strengthening exercises, weight bearing is anything that you are exercising against gravity. Go upstairs, or jog, or you don't even have to jog or run. You can just walk. Simple 30 to 45 minutes of walking. That's all it takes. So that would be my advice for my patients. That what I usually advise. But yes, you're right. I'm happy that you actually brought this up. I think we're also working on something with our patients where we test their bone mineral density test. And I always, in all my diabetic patients and non-diabetic, after a certain age, we do recommend getting bone density tests done. Just so half of them don't even know what that means. So I think it's our job to sort of educate them, tell them what it is, and push them to prioritize it, get it done, why it's important, tell them the risk factors of fractures, because once the old age comes and they get fractured, the healing, and especially with diabetic patients, healing takes a lot longer, or sometimes they even have worse complications. And the other risk factors they have. So that's just my advice. And yeah, my take home message would be start early, start prioritizing your bone health, get your vitamin D levels checked, and do some weight bearing exercise. Thank you, Dr. Vipul.
Thank you. Thank you so much, Dr. Smriti. And if Bansi sir is living, I would like to ask him a say very simple last take home message for all of us, that if you could change one major misconception about women metabolic health, what it would be, and what message would you like to give to all the audience and in the end?
So, Smriti, I'm slightly differing with you that, I would say that one last message that, we should start making young girls to do exercise. It has to be at a very pediatric age group. And we should try to make them healthy mom from that age group. And that's what the primordial prevention, if you want. So if my daughter is of 10-year-old or a 12-year-old, maybe before puberty, she should start doing more exercise to increase in her height, not in her weight, because the maximum number of your fat cells are, they are before the age of 9. So if you will make someone obese at that age group, lifelong their fat cells will not be, number of cells will not decrease. Then what you can do, you can decrease the fat inside. The adipocytes are now fixed. So try to decrease that fat cells, and that time we should try to increase the more of muscle cells. Now during puberty, they should become more healthy. So the chances of getting the PCOS or the obesity, because these are a common question, must be your patient must be asking that even I decrease my weight, or it's really very difficult to decrease my weight, my metabolic health is really very poor, or my BMR is very low. It's very difficult because your adipocytes number of that are fixed now. Now you can just try to decrease your fat inside the adipocyte, but you can't decrease the number of cells. So as soon as you again gain some energy in your intake, you will again become obese or overweight. So that's a challenge. So I think what we should try to explain to the society that they should do exercise should be a part of habit. It is not like that, it's a part of routine for every child, for every young adult, for every one who is going into school. So that should be habit. And that is what our Honorable Prime Minister just before in Ban Ki Baat also talked about, that obesity to be decreased. So that obesity to be decreased from the level of pediatric age group. That's first of very, very important aspect. If someone knows in his school health, and how important it is to do a regular exercise, how important it is to have high protein intake, how important it is to have low carbs, how important it is to have no ice cream and no confectionery. These are the items which will make someone healthy. And we have to make them healthy mom for next 15 years. We don't want that they should get a problem of not getting a normal delivery. They get a cesarean section and getting what a low birth weight child. Again, if 2.5 kg or 2.3 kg and 2.7 kg. And then again, the next generation, they are going to have the same problem. So this vicious cycle, somewhere we have to go back. Then, you have to work for these pediatric age groups. So I fully agree with you all the points, Smriti, that at the age of 30 they should do definitely, because we adult physician get the patients or someone who comes to us at the age of 30. But my here the last message is, those who are coming to you at the age of 30, tell them for their children, tell them for their young adults, tell them for their your next birth, the newborn, how you have to. And very important message which I would like to say, that please don't allow the newborn to have sweet, because when up to 6 months or 3 months, when mother milk is not having no sugar, when cow milk is not having sugar, who are you and me to add this sugar after 6 months, the milk of that child or to whom we want to give? So I mean, ask the mothers that please don't add sugar. Sugar is an artificial thing, it's a chemical, definitely. It's not natural. Even the jaggery is also not natural. Tell them not to have it. So the lifelong, the mother or the child should not say that I have a sweet tooth. Every time they eat and they wanted to eat one or two piece of sweet, and they always complain that no, no, Dr. Saab, I can't leave it because I have a sweet tooth. So that's some message which we can give to the society, and this is how we can decrease the obesity at mass level. Because individually is fine. Someone had come at the age of 30 or 25 or 50 or 60, you are going to prevent the obesity, you are going to give the all the advice which you are rightly saying. But for mass, for society, for community, for making healthy India, we have to think that a newborn, from newborn to young age, the young adults, we have to work for that. Thank you, Vipul, once again. Thank you for this wonderful discussion. I really enjoyed everyone, and I'm sorry that I have to attend one more with that. Thank you. Sorry.
Thank you.
Thank you.
Thank you,
Thank you
sir.
so much, Vansi sir. You need not to say sorry. You already discuss and give wonderful insights about it. And one good news I would like to share to you all, that we are in the final of Champions Trophy. Sorry, I was distracted for a couple of minutes. Thank you, sir. Bye, sir.
But that's
Thank
a
you,
very
sir.
good news. It's very good news. Now I think, Vipul, let us make the plan to go Dubai, to see
Dubai
final.
for the final. Yes, sir.
Bye bye.
Thank you,
Bye,
sir.
sir.
Bye,
Bye.
sir. Bye.
Good night.
Yeah. And also, let's take some wonderful insight from Dr. Dhruvi, that women often puts themselves last when it comes to the health. They always don't prioritize her health over any family member's health. What is one small but very impactful change that every woman watching this session can make today to prioritize her health well-being? Can you give one simple tip?
Learn to say no. Learn to set boundaries. Learn to say no. That's one of the most difficult things. Yeah, that's my one last message to my audience, to everybody listening to me today.
Yeah, that's very important thing, to make the full stop at many things, and that will end many consequences or cascades. Wonderfully explained. To Dr. Nimi, that sexual health remains a silent struggle for many women. What is one piece of advice that you would give to both healthcare providers as well as women themselves to normalize these conversations in OPD as well as at any platform?
For healthcare providers, for physicians, one advice would be open to the topic, be open to ask the question of how are you doing physically, sexually, how are you doing in terms of other aspects besides their general appearance. To patients, male, females. Males are usually more vocal and they are usually the first ones to ask upfront about their erectile dysfunctions, loss of libido, etc. Females, they are usually little less vocal, more timid. So, to females, I would like to tell them prioritize yourself. Again, it might sound like a broken record of what our previous panelists say to Dr. Dhruvi. But when I say prioritize yourself, I mean prioritize your sexual well being as well. Ask the questions. As doctors, if we are not opening up the conversation, as patient, you can at any time. We are here as a non judgmental persons. So that will help us give you more holistic approach of treatment, be it counseling, medical management, physical activity advice, everything. But you have to ask the correct questions to us.
So ask to get more information, ask to get correct information, and after asking, try to practice that.
Absolutely.
Thank you, Dr. Nimi. And last but not least, Dr. Smruti Trivedi, that we have improved the longevity in human life, but whether we have improved the quality of life, it is a question. So, if there is one lifelong habit that you could recommend for all the people and specifically women to have stronger bones, what would it be?
I think my question was quite well answered by Dr. Bansi Sabu sir. So he
So
made my
start early and do exercise,
start early and do weight bearing exercise.
weight bearing
That's
exercise.
what's important. And I want to add something to Dr. Nimi as well. There's a lot of blame game that goes on, especially with sexual dysfunction, that women blame themselves a lot. So I think it's very important when patients come to us, and in case first things we have to sort of tell them or advise them is, please, this is it's not your fault. That's one of the first things I say as well when they come to me, if they come to me at all with that question. You have to let them know and assure them that it's not your fault. That's just one thing that I thought, I would just wanted to add that. But yes, otherwise, that's all I have to say. But yes, start early, start exercising, get out there.
Thank you so much. With respecting the time, it's already 9:42, so not taking many more questions. I would request Dr. Dhruvi to share vote of thanks before we end this one of the wonderful, enlightening, interactive, and talking about the topics that are mostly keep under the carpet. Over to you, Dr. Dhruvi. Thank you.
Thank you so much. This has been such a wonderful interaction, and seeing so many logins despite the semi-final has been a very overwhelming aspect of the entire program. I would start by thanking all the he's present in our program, Dr. Banshi sir, Dr. Dharmendra, Dr. Rutul, Dr. Vipul, who have organized this entire program, and our she's the she's who have been a very constant part of my life, the constant part of in making the journey of rims such a huge success. Dr. Nimi, Dr. Smriti, Dr. Parul ma'am, who's still here, thank you ma'am. Dr. Urvi, Dr. Vidisha, who was here despite some schedule constraints. And that reminds me to thank all our audiences, irrespective of their gender, to stand up and to talk about women healthcare talk about any taboo topics in a very comforting yet scientific manner, in a way that we are encouraging all the females to take care of themselves and all the males to take care of themselves along with their family. I also thank our knowledge partners, USV, for providing us this wonderful technical platform. And thank you to Almighty, wishing every one of you a very happy International Obesity Day today and a very happy Women's Day in advance. Wishing for more He for She programs from a lot of she's in the audience. Please do not hesitate to contact us as Team RIMS if you have any ideas related to women healthcare. With that, signing off, thanking every one of you and wishing you great happiness and health. Thank you so much.
Thank
Good
you.
night.
Good night. Stay healthy, stay happy, stay connected. Bye bye.
Bye.
Thank you. Bye bye.